First of all, we will see alcohols. What are the different alcohols? What are the different pharmacological actions of alcohol on various human systems? Then, what is the metabolic pattern of various alcohols, and what is the use and how to tackle their how to tackle their poisoning and all that. So, first of all, there are two alcohols that come in immediately in your mind. First one is ethanol, second one is a methanol. Okay, deal mostly with the two type of alcohol, that is ethanol and methanol. So ethanol is nothing but the ethyl alcohol CH3CH2 OH, and your methanol is nothing but the CH3 OH. Okay, there is another there is another one known as a propylene glycol. Sorry, ethylene glycol. There is another one known as ethylene glycol, which is used as a refrigerant, which is used as a which is used as an anti-freeze agent in various different use. Okay, so accidentally sometimes that also get consumed by little ones, children and all that. So will also discuss about that also. So various types of alcoholic beverages. So there are different type of alcoholic beverages depending upon the concentration of alcohol in that beverages. So first one is the malted liquors. Okay, so malted liquors means what? So the liquors containing self-generated alcohol or fermented generated alcohol by fermentation. Okay, so alcohol by fermentation or that is fermentation. Okay, so alcohol obtained by fermentation of germinating cereals. The alcohol is undistilled. Okay, so it is not distilled from, it is not separated from mother liquid. Okay, so just you have taken a cereals or you have taken a sprout and you have make a fermentation, and whatever alcohol is generated in the fermentation along with that mother liquid. Okay, along with that mother liquid, so that is nothing but the malted liquor. Okay, so for example, sugar containing grains like barley, then your rest of the grains, so wheat, barley, rice, these consist of sugars. Okay, and you are well aware that sugar is converted into alcohol by the process of fermentation by using one enzyme known as the zymase. Okay, so sugar will be converted into alcohol by zymase, right? There are different kind of alcoholic beverages. First one is a malted liquors. Malted liquors. So it is the alcohol in this liquor that is obtained by fermentation of germinating cereals, then grains and all that. Okay, so that alcohol is not separate, that is not undistilled. Okay, so alcohol content in this kind of preparation is around 3 to 6%. And if you take an example of beer, okay, so if you take an example of beer consists of around 8 to 10% alcohol. Okay, so that is a volume by volume. So that is a malted liquor. Okay, so second one is a wines. What are the different wines? So wines also consist of alcohol. Okay, ethanol mostly. So whenever we will take a term alcohol, it mostly means ethanol. Okay, mostly it means ethanol. So in case of wine, alcohol is again generated by fermentation of natural sugar present in the various fruits like grapes and other fruits. It is also undistilled, it is also not separated. Okay, so it is also not separated from the mother liquor. Okay, that means fermentation liquid. So the alcohol is in the fermentation liquid in a crude form, it is not separated. So that is nothing but the wine. Whatever you drink, अगर आपको वाइन रेड वाइन्स वगैरह पीने का शौक है तो उसमें सब ग्रेप से ही फर्मेंटेशन करके जो जनरेट होता है अल्कोहल उसमें होते हैं. ओके, सो फर्मेंटेड grapes consist of alcohol, and alcohol along with that mother liquor, that is nothing but the wine. So it is also undistilled. So example is red wine, then champagne. Champagne consists of 12 to 16% of alcohol. Then again there is one more known as the spirits. Okay, and this is the mostly consumed alcohol. Okay, so spirit, it is a distilled after the fermentation. Okay, so you carried out a fermentation of your barley, your rice, or whatever is the raw material used for the fermentation. Okay, so if you carry out the fermentation and if you have separated that alcohol, so that is all known as a spirits, and that alcohol is used for the various kind of beverages. For example, rum, whiskey, brandy, vodka, gin, etc., etc. I'm not a drunkard. I know the names. Okay? So rum, whiskey, brandy, vodka. So it consists of around 40 to 55% alcohol, which is fermented, but it is a distilled of. Okay, so it is not along with the mother liquor. So in previous two cases, malted liquors and wines, so mother liquor and alcohol was in it was not separated. Okay, so but in case of spirit it is separated. Okay, so vodka, rum, then whiskey, brandy, then gin, etc. They can stop around 40 to 55% volume by volume alcohol. Okay, so mostly the mostly the wines, mostly these liquors, spirits, so they are mostly sold in India. Okay, so actually they are sold worldwide, and most of the people they used to drink it. Okay, so in India all brands are listed, that is available in the market, licensed, which will consist of 42.8% volume by volume or 37% weight by weight of alcohol. So these brands will not exceed this concentration, that is a 42.8%, 42.8% volume by volume. कि आपका जो रम है, विस्की है, ब्रांडी है, वोडका है, उसमें इससे ज्यादा कॉन्सेंट्रेशन अल्कोहल का नहीं होना चाहिए, कि दैट इज नॉट लाइसेंस्ड. अगर उससे ज्यादा अगर कॉन्सेंट्रेशन पाया जाता है तो उस जो भी कंपनी है उसके ऊपर एक्शन लिया जाएगा, उसका बैन किया जाएगा. हाईएस्ट कॉन्सेंट्रेशन ऑफ अल्कोहल इज फाउंड इन दीज काइंड ऑफ बेवरेजेस लाइक rum, whiskey, brandy, vodka, and all that. There is one more, another one beverages known as the desi. So in that desi also there is a variable concentration that is also below the 42.8%. देसी का मजा ही कुछ अलग होता है. जो देसी के लवर्स होते हैं वो अलग होते हैं, बहुत ही ज्यादा झूमते हैं. बाकी जो लिकर से उसमें ज्यादा झूमते नहीं वो लोग. जो भी होता है देसी का मजा है वो अलग है. मैंने तो कभी नहीं पी है. और नेक्स्ट वन इज there are certain terms related with alcohol. Absolute alcohol, then rectified alcohol, then proof spirit. Okay, so these terms are very important, you should know. What do you mean by absolute alcohol? So absolute alcohol is nothing but the purest form of alcohol. It is a 99% weight by weight of alcohol, that is ethanol. So ethanol, see what happens during the separation of ethanol, there is a little bit amount of water present in the ethanol. So you have to remove that water. You can remove by azeotropic distillation. Okay, we have seen this. So absolute alcohol are prepared by azeotropic distillation. Okay, so it is a dehydrated ethanol, that is a 99% weight by weight, that is known as the absolute alcohol. Okay, then again next one is the rectified spirit, which consists of around 90% of weight by weight ethanol. Okay, 90%, that means 10% there is a water. Okay, 90% ethanol, 10% is water, that is a rectified spirit. Okay, then again there is another term known as a proof spirit. Okay, so what is proof spirit? Proof spirit is nothing but the 57.1% volume by volume or 49.9% weight by weight ethanol, that is nothing but the proof spirit. Means actually it was a older term कि गन पाउडर लेते, गन पाउडर में वो अल्कोहल का स्प्रे करते हैं और आग लगाते हैं, अगर वो बर्न होता है तो दैट इज अ प्रूफ, दैट इज अ प्रूफ, दैट इज अ स्ट्रेंथ, प्रूफ स्ट्रेंथ, दैट वाज नोन एज प्रूफ स्ट्रेंथ. But nowadays, for a forensic purpose, they have decided proof spirit is nothing but a 57.1%. ये भी क्वेश्चन एक दो बार जूरिस्प्रूडेंस का क्वेश्चन आता है, इसमें एक बार क्वेश्चन आया था जूरिस्प्रूडेंस के लिए, वही मतलब व्हाट इज प्रूफ स्पिरिट, 57.1% of ethanol. Okay, so do you have different kind of alcoholic beverages, malted liquors, wines, spirits. Okay, so most of the highest concentration of alcohol is present in the these spirits, for example whiskey, rum, vodka, brandy, and all that. Okay, so beer consists of around 10% alcohol, that is a self-generated alcohol, and this is not distilled off. Means the alcohol and fermented liquid is not separate off. They are just purified, not separate. It is just purified and clarified, but not separate. In case of wine also. So this was about the types of alcoholic beverages. Now we'll see what is the pharmacological actions and what are the different pharmacological effect of ethanol on our. So अगर आपने मान लीजिए कि आपने एक दो पैक लगाई, ठीक है, तो आपके ऊपर क्या एक्शंस मिलेंगे. So what are the different pharmacological actions of ethanol? So you know that alcohol is a nothing but the CNS depressant. It is also CNS stimulant. It is also CNS depressant. It is also a hallucinogen. So that those related actions are there. Means unpredictable actions are there. So there are different pharmacological actions of ethanol on your body. So what is local action? Locally, if you try to apply ethanol locally, so it will act as a rubefacient, counter irritant, and it is an antiseptic also. So antiseptic, whenever you will add antiseptic and disinfectant. So antiseptic means what? a drug which will prevent the multiplication of your microorganism. That is a bacteriostatic that will prevent the growth of microorganism. Okay, but what is disinfectant? Disinfectant means that will kill the microorganism present over that area. Okay, that is disinfection. Now this alcohol is used as an antiseptic disinfectant in a concentration range of 70% to 90%. It is used in the concentration range of 70 to 90% as an antiseptic. Beyond this concentration, it is antiseptic, but it is a dehydrating to the skin. Mostly it is used in this concentration range only. 70 to 90% alcohol is used as a antiseptic externally, right? Not internally. 70% internally आप लेंगे alcohol तो मर जाओगे. What is the effect of this ethanol on CNS? So central nervous system में क्या effect है? So it is a depressant. It has a depressant action. It has a CNS stimulation action. It is a hallucinogen. आपके CNS को depress करेगा. Initially आपके CNS को low dose में आपके CNS को stimulate करेगा. मतलब CNS stimulant at a low concentration. At जैसे ही concentration बढ़ जाएगा, उसका CNS depression कर जाएगा. ठीक है? So it will depress your CNS by acting on various neurotransmitters. So it will increase the activity of GABA, and you know that GABA is nothing but the inhibitory neurotransmitter in the brain, right? We have seen in the last lecture also. So it will promote the action of GABA, then also inhibit the NMDA receptor. So NMDA means N-methyl deaspartate. Okay, it is an excitatory neurotransmitter. Okay, so it will inhibit. Then also it will increase the concentration. It will augment it will also decrease the concentration of 5-HT3. That is a stimulatory in nature. That's why how CNS it is acting as a CNS depressant on the CNS. Now what is the action of this ethanol on cardiovascular system? So cardiovascular system is your heart, your blood vessels and all that, blood pressure and all that. Okay. So cutaneous vasodilation. So initially your alcohol will cause cutaneous vasodilation. So as there is vasodilation, you will have red base. देखो आप जो बेवड़े ने दारू पिया है मतलब या भी वाइन पिया है जो भी पिया है तो उसको चेहरे पे एक रेडनेस आता है. ठीक है, उसके चेहरे पे एक रेडनेस. व्हाई देयर इज रेडनेस? बिकॉज देयर इज अ क्यूटेनियस वैसोडाइलेशन. सरफेस के जो ब्लड वेसल्स होते हैं उसको डायलेट कर देता है. ठीक है, तो दैट्स व्हाई उसका थोड़ा सा पिंकिश टाइप ऑफ कलर लगता है. ठीक है, सो क्यूटेनियस वैसोडाइलेशन इन स्मॉल डोसेज. इन मॉडरेट डोसेज, ठीक है, इन मॉडरेट डोसेज इट विल कॉज अ टैकीकार्डिया. थोड़ा सा डोज बढ़ा दे तो उसको अपना सीवीएस जो है आपका कार्डियोवास्कुलर सिस्टम उसको स्टिमुलेट करेगा, मतलब हार्ट को स्टिमुलेट करेगा, हार्ट रेट बढ़ाएगा. दैट इज टैकीकार्डिया. नॉर्मल मोर हार्ट रेट देन नॉर्मल, दैट इज टैकीकार्डिया. लेस हार्ट रेट देन नॉर्मल, दैट इज अ ब्रैडीकार्डिया, राइट? So it will cause tachycardia, increase in blood pressure due to vascular activity. Then sympathetic stimulation. It will cause sympathetic stimulation. It will release the adrenaline. Okay, it will release the adrenaline. In the larger dose, it will cause a depressant effect on CVS. So initially cutaneous vasodilation, stimulant effect, and then in large doses, it will depress the CVS. Okay, cardiovascular system. So depression of myocardial muscle of your heart. So again it will decrease your blood pressure, myocardial contractility and all that. And vasomotor also depresses the vasomotor centers. Means जो vasomotor centers है आपका जो कंट्रोल करता है आपके कार्डियोवास्कुलर सिस्टम को, so उसको भी डिप्रेस करेगा. So ultimately it has a biphasic response, right? So initially different response, moderate dose different response, higher dose different response. So initially vasodilation, then vasodilation in moderate doses it will cause a stimulation of your heart, tachycardia, rise in blood pressure and vascular activity. Then again in larger doses will depress the CVS. Next one is what is the effect of ethanol on GIT, your gastrointestinal tract. Okay, so this is very important. बहुत सारे लोग ऐसे होते हैं वो बोलते हैं नहीं यार मैं तो मुझे पीने का शौक नहीं, पीता हूँ गम बुलाने के लिए, या फिर बोलते हैं मुझे पीने का शौक नहीं, पीता हूँ पचने के लिए. ऐसा नहीं है, 4 पैक नहीं पीते पचने. So what is the effect of ethanol on GIT? So in low concentration, maybe up to 10%. If there is a 10% alcohol, so it will stimulate the gastric acid secretion. It will increase the gastric acid secretion in the 10% concentration only. Okay, less than 10%. So in 10% of alcohol, if there is 10% alcohol, so it will increase your gastric acid secretion. It is a stomachic. It will act as a stomachic. So it will increase the gastric acid secretion. But in higher concentration, it will decrease the acid secretion. In higher concentration, it will decrease the acid secretion in the stomach. It will damage your damage your mucosal lining of your stomach. So it is irritating, and you will get a vomiting, gastritis, and mucosal congestion. Okay, in the large doses. So alcohol will act as a gastric. It will act as a stomachic. It will increase the gastric acid secretion in the less concentration, low concentration. Okay, so up to 10% only. But if you are taking more than 10%, that means you are suppressing your gastric acid. Okay, so alcohol पचने के लिए कितना जरूरी है? सिर्फ 10%, बाकी ज्यादा नहीं. मतलब आपका gastric acid secretion करेगा 10%, बाकी ज्यादा नहीं. ठीक है. Now next one is, what is the effect of your ethanol or alcohol on the liver? So if you take initially smaller doses, so normally normally 1 or 2 peg per day, so it will not harm you. It will not harm you. So that's why most of the people, they used to tell you, so alcohol is good for body within the limit. But once you cross the limit, that is adversely affecting your body, right? So that's why, so chronic use of alcohol causes liver damage. Chronic use of alcohol causes liver damage. Okay, so alcohol का ज्यादा यूज करेंगे आप, बेवड़े की तरह बिहेव करेंगे, कभी मिला नहीं ऐसा पिएंगे, तो आपका लिवर डैमेज हो जाएगा. ठीक है. So chronic use of alcohol will cause liver damage due to the metabolism. Normally what happens, ethanol is metabolized in the liver by alcohol dehydrogenase. Okay, so ethanol will be converted into acetaldehyde, and then acetaldehyde will be converted into acetic acid by the enzyme aldehyde dehydrogenase. We will see in the upcoming slide about, don't worry. Chronic use of alcohol causes liver damage because of acetaldehyde produced during metabolism. This acetaldehyde will cause inflammation of hepatocytes. So जो hepatic cell होते हैं उसको क्या करेगा? Inflammation करेगा, उसको damage करेगा. So it is also known as alcoholic cirrhosis or liver cirrhosis. Alcoholic liver cirrhosis. So once there is alcoholic liver cirrhosis, alcohol का जो डैमेज हो गया आपके लिवर को, तो वो जो सेल्स डेड सेल है, वो आपका डेड सेल जो है, उसका डेड सेल मतलब डेड सेल होने के बाद उसका एक डिपॉजिट हो जाता है आपका मास वहाँ पे लिवर पे, और आपका लिवर सूज जाता है, तो उसको उसमें फैट भी डिपॉजिट होता है, तो उसको बोलते हैं फैटी लिवर. अगेन दिस अल्कोहल विल इंक्रीज द माइक्रोसोमल एंजाइम, ओके, ऑफ लिवर. सो इट विल इंड्यूस द माइक्रोसोमल एंजाइम्स. मतलब ये मेटाबॉलिज्म करने वाले जो एंजाइम है उनको इंड्यूस करेगा. तो इसके साथ में अगर कोई दूसरा ड्रग लेंगे आप, तो उसका मेटाबॉलिज्म फास्ट होगा. ठीक है. सो एज इट इज एंजाइम इंड्यूसर, इट विल हैम्पर द मेटाबॉलिज्म ऑफ अनदर, राइट. देन अगेन दिस अल्कोहल इंक्रीजेस द फैटी एसिड सिंथेसिस. So in the liver it will increase the fatty acid synthesis. That's why जो लोग इनिशियली कम कंसंट्रेशन में मतलब लिमिट में ही ड्रिंक करते हैं, तो उनका वेट गेन होता है, उनका टमी बढ़ जाता है, because there is increase in the synthesis of fatty acid. So fatty acid will be synthesized and it will be deposited on your stomach area or tummy area, and that will increase the weight. So that's why alcohol in a limited amount, that is good for health. Limit is exceeded, then it will adversely affect your body. Okay. Then what is the effect of alcohol on the skeletal muscle? Myopathy because of chronic alcoholism. So it will decrease the functioning, it will decrease the strength of your muscles. So that is nothing but the myopathy. Decrease, or it will degenerate your muscles. That is a myopathy. Then again, this alcohol has a in small concentration, alcohol increases the HDL, high density lipoprotein. So that is a cardioprotective in action. हाई डेंसिटी प्रोटीन आपका बढ़ जाता है, तो उसका मतलब अच्छा है, आपको आर्थ्रोस्क्लेरोसिस या फिर कोई भी अगर दूसरा जो है आर्थ्रोस्क्लेरोसिस का चांसेस कम हो जाएगा. लेकिन अगर ज्यादा डोज लेंगे अल्कोहल का, सो इन हायर डोसेस इट विल इंक्रीज द LDL. So low doses it will increase the HDL. In the low doses it is a cardioprotective. Okay. So that's why in the most of those people who used to drink alcohol, they will have less incidences of arteriosclerosis. So उनका बाईपास सर्जरी में ज़्यादा ये नहीं होगा, लेकिन जो ज़्यादा पीते हैं उनको तो 100% बाईपास सर्जरी. Then what is the kinetics of alcohol? So alcohol will follow zero order kinetics. Remember, alcohol will follow zero order kinetics. Means it is dose dependent kinetics. It is not dependent on the. So usually what happens, your carbohydrate gives you around 4 calorie per mole. Then fat will give you around 6 calorie per mole. But alcohol will give you 7 calorie per mole. So highest energy is given by a molecule of alcohol. One molecule of alcohol will give 7 calorie. One molecule of carbohydrate will give 4 calorie. One molecule of lipid will give 6 calorie. So you will say, as sir, as it is giving more calorie, then why we are not consuming alcohol daily? No, it's not a food. So that it is not a food. 7 kilocalories giving, it's okay, but it is not utilized. It is not utilized by body. Then again, this alcohol is not an intermediate in the metabolic processes. So as there is a carbohydrate is a carbohydrate is a metabolic intermediate. Then lipid is also metabolic intermediate. From carbohydrate you can synthesize lipid. From lipids you can synthesize carbohydrate. From carbohydrate you can synthesize protein. So that is the interconnected to a metabolism. But this alcohol is not interconnected to metabolism. That's why it is not a food. Okay, right? So alcohol food नहीं है, उसको हवरी तरीके से खाने नहीं है, आपको पीना नहीं है. Now next is, so next one is if you take alcohol in a very large quantity, आप ज़्यादा ही पिए हो तो sometimes whatever, so आपको एक लत लग जाती है. So alcohol is a drug of abuse, or it causes addiction, tolerance. So if you get addicted to alcohol, then it is not easy to recover you. So there are certain steps, there are certain protocols that should be followed to recover that patient. If anybody has addicted to alcohol and you want to break that, आपको अगर उसको नहीं पीने देना है तो उस टाइम पे क्या करेंगे? उस टाइम पे डिफरेंट ड्रग्स यूज होते हैं, डिफरेंट प्रोटोकॉल होता है उसका. तो ऐसा नहीं कि अगर कोई बंदा, if anybody is drinking alcohol since from last 6 months and suddenly if you try to withdraw that alcohol, it will not happen. If you withdraw, then the patient will, or the subject will get withdrawal symptoms. So वो रोने लगेगा, उसके आंख से आंसू आएंगे, उसका ब्लड प्रेशर बढ़ जाएगा, उसका पल्पिटेशन होगा, उसमें सब ये हो जाएगा, स्वेटिंग आ जाएगा, ब्लड प्रेशर बढ़ेगा उसका. ठीक है, सीनियस एक साइकोलॉजिकल बिहेवियर चेंज हो जाएगा उसका. So if you try to withdraw the alcohol of addicted people suddenly, then he will show withdrawal symptoms, right? So how you have to treat that withdrawal symptom? So there is certain protocol. So there are certain drugs which are approved for the withdrawal of your alcohol. So drug used in the intoxication of alcohol. Okay. So first one is a naltrexone. This naltrexone is a opioid antagonist. So opioid जो मॉर्फिन कोडीन थिबेन होते हैं आपके, ठीक है, उसका अगर एब्यूज होता है तो उसका अगर टॉक्सिसिटी होता है तो ये नैल्ट्रोक्सेन देते हैं. तो नैल्ट्रोक्सेन इज अ opioid antagonist and it is also approved by US FDA for the comprehensive treatment program for alcohol dependence. ठीक है, so जो अल्कोहल का लत लगा है, जिसको दारू का लत लगा है, उसको छुड़ाने के लिए नैल्ट्रोक्सेन यूज करते हैं. ठीक है, अगेन acamprostate, then topiramate is an anti-epileptic drug, so it is also used to treat the alcohol dependence, right? Now again, chronic dependence, it is about the acute dependence. Okay, so this drug is used in acute dependence. So what happens if you are chronic dependent? So there is one drug known as a disulfiram. There is one drug known as a disulfiram. It is used in the chronic dependence. आपको बहुत साल से लत दारू की लत लग गई और छुट्टी नहीं रही हो, उस टाइम पे क्या करना है? आपको डाइसल्फिराम का यूज करना है. और डॉक्टर, और दिस डाइसल्फिराम you have to use in the hospital only. Disulfiram treatment you have to carry in the hospital only. So we'll see the mechanism of disulfiram. What is mechanism? So it will inhibit the aldehyde dehydrogenase. Okay, suppose that आपने disulfiram का टेबलेट ले लिया है, आपको डॉक्टर ने दिया है, और आपने उसके बाद में ड्रिंक किया, अल्कोहल का ड्रिंक किया, तो क्या होगा कि आपके बॉडी में अल्कोहल जाएगा, उसका मेटाबॉलिज्म चालू हो जाएगा. ठीक है, अल्कोहल का मेटाबॉलिज्म होगा एसिटाइलडेट बाय अल्कोहल डिहाइड्रोजेनेस. उसके बाद एसिटाइलडेट का होगा इसमें एसिटिक एसिड बाय द aldehyde dehydrogenase. ये नॉर्मली होता है, लेकिन आपने क्या किया है? डाइसल्फिराम लिया है. तो डाइसल्फिराम इज अ aldehyde dehydrogenase inhibitor. So I will explain it again, don't worry. Aldehyde dehydrogenase, तो ये इनहिबिट करेगा, तो there will be no conversion of acetaldehyde to the acetic acid. So there is an accumulation of acetaldehyde in your body, and acetaldehyde has a very noxious effect on your body. So you will get a vomiting, you will get a headache, you will get a high blood pressure, you will get a palpitation and all that. कि इतना परेशान हो जाओगे आप कि ये क्या हो रहा है. तो इसलिए जो भी अल्कोहल का एडिक्ट होता है, उनको बिना पता ये हॉस्पिटलाइज लेके जाते हैं और उनको बिना पता ये टैबलेट देते हैं. कौन सा? डाइसल्फिराम. और उसके बाद में उसके पास एक बॉटल रख देते हैं, पी कितना पीना है. अगर उसने पिया तो उसको ये सिम्टम्स हो जाएगा ऑटोमेटिकली, क्योंकि aldehyde dehydrogenase inhibitor. तो उसके बॉडी में एस्टाइलाइड एक्यूमुलेट हो जाएगा और उसका सिम्टम्स मिलेगा और वो सोचेगा यार कि क्या हो रहा है, जैसे दारू पीता हूँ मुझे मेरी तबीयत खराब होती है, दारू पिया तबीयत खराब हो जाएगी, तो वो ऐसा करके छोड़ देता है। सो इट इज यूज्ड एज अ used in the chronic alcohol dependence, that is a disulfiram, right? So aldehyde dehydrogenase inhibitor, and as this disulfiram is a dangerous drug, so you have to carry out the treatment in the hospitals only. Next one is it was all about the ethanol. So we are not taking each and everything about the ethanol and all that, but whatever is important points for GPAT, that will be discussed. So second one is a methanol. Second alcohol is methanol. So it is seldomly used. It is not used for consumption. So it is also known as wood alcohol. This was the question again in GPAT. Methanol is known as a wood alcohol. It is also metabolized in the body to the formaldehyde, okay, by alcohol dehydrogenase, and further it is metabolized to formic acid by aldehyde dehydrogenase. This formaldehyde is very poisonous compound, okay. So we will discuss again in the next slide regarding this. So methanol is a poisonous in nature, and methanol is a poisonous in nature. It is very poisonous. Even 10 ml of methanol, if you consume 10 ml of methanol accidentally, methanol is mostly used as a solvent in the various purposes. For example, in your lab you might have a methanol bottle over there. In the various pharmaceutical industry, methanol is used as a solvent, okay. So if you got accidentally 10 to 15 ml of methanol consumed, you will die immediately within the next 20 minutes, because methanol is very poisonous. So it is metabolized in the body to the formaldehyde, and formaldehyde is very poisonous compound, okay. Again, formaldehyde will be converted into formic acid by aldehyde dehydrogenase. We'll discuss that. So in that case, what you have to do, you have to use one drug that is known as a fomepizole. So it is a selective and irreversible inhibitor of alcohol dehydrogenase, not aldehyde. Fomepizole is a alcohol dehydrogenase inhibitor. This was a aldehyde dehydrogenase inhibitor. Disulfiram was a aldehyde dehydrogenase inhibitor. This fomepizole is a alcohol dehydrogenase inhibitor, okay. So it is a 4-methyl pyrazole derivative. We will see everything about this structure and all that in the medicinal chemistry. It will inhibit the alcohol dehydrogenase and it will prevent the formation of formaldehyde from methanol. Again, in case of methanol poisoning, you can use ethanol also. आप बोलेंगे सर कैसे मिथेनॉल की पॉइजनिंग में इथेनॉल कैसे यूज करेंगे? So ethanol and methanol, they have structural similarity. So ethanol will act as a competitive agonist to the alcohol dehydrogenase. methanol की जगह इथेनॉल जाएगा अल्कोहल डिहाइड्रोजेनेज के एंजाइम के पास और वहां पे उसको सैचुरेट कर देगा. So obviously if alcohol dehydrogenase is saturated, then your methanol will not be converted into formaldehyde. Another is known as ethylene glycol. Another alcohol is known as ethylene glycol, okay. So it is also used in the various purposes. So it is an anti-freeze agent, okay. It is an anti-freeze agent, so it is also present in various utilities. So sometimes what happens, accidental consumption of ethylene glycol leads to poisoning, okay. So it is also alcohol, so it is oxidized in the body to by the alcohol dehydrogenase to the glycolic acid, okay. So it is metabolized to a glycolic acid, and further this glycolic acid is metabolized into glycoxylic acid by aldehyde dehydrogenase, and later on it is converted into oxalic acid. So alcohol dehydrogenase will convert ethylene glycol into glycolic acid, glucoaldehyde, then glucoaldehyde will be converted to glycolic acid. This is also very poisonous, and this also leads to poisoning. So in that case also you have to use fomepizole, which is a drug of choice, okay. So drug of choice in the alcohol poisoning, that is a fomepizole. So mostly fomepizole is mostly used in the treatment of poisoning of methanol and your ethylene glycol. It also used in the poisoning of alcohol also, but ethanol also, but mostly in methanol and in case of ethylene glycol, okay. So you just try to remember the drugs used in the poisoning, okay. Now we'll see the metabolism of alcohol, various alcohols. There are three kind of alcohols, you know that, ethanol, methanol and ethylene glycol. So metabolism of alcohol. So first one we will see ethanol. So ethanol, if you take, अगर आप बेवड़े हो, पीते हो, ओके इथेनॉल, तो क्या होगा आपके बॉडी में, आप इथेनॉल लिया आपने, सो इथेनॉल विल बी कन्वर्टेड इनटू एसिटाइलेट by alcohol dehydrogenase. This alcohol dehydrogenase will convert ethanol into acetaldehyde. Further, acetaldehyde will be converted into acetic acid by aldehyde dehydrogenase. Okay. Now see. So this alcohol dehydrogenase is mostly present in the cytoplasm of liver cell. This aldehyde is present in the mitochondria of liver cell. Okay. आपने अगर हद से ज़्यादा पिया है, so if you take alcohol more than normal dose, so raised level of alcohol in your blood what will cause, आप देखो जो ड्रिंक किया वाला सब्जेक्ट होता है, जैसे आपने देखा होगा रास्ते पे कैसे चलता है, सो इट विल हैव अ सोशल एबिलिटी, इट विल हैव डिस्टेंस फ्रॉम सोशल एबिलिटी, वो अकेला ही चलता है कुछ ना कुछ। ओके, सो उसका गेट देखिए, उसका चलने का पैटर्न देखिए, गेट मीन्स खड़े रहने का पैटर्न, सो ही विल नॉट, वो ठीक से खड़ा भी नहीं रह पाता, ज्यादा अल्कोहल मतलब फुल टल्ली हो गया वो, मतलब पूरा टल्ली हुआ है उसको बहुत सारा, so he will not work properly, so he will have a gait problem, so large amount of alcohol in the blood will result in the gait problem. Then ataxia क्या होता है, it is also motor incoordination, you cannot perform the activities in the normal way, चल नहीं सकते आप easily, move नहीं कर सकते क्या जगह, so ataxia is different thing, I will explain. Then again decreased motor functioning, decreased mental functioning, then decreased memory and reaction time. For example, आपने अगर नॉर्मल सब्जेक्ट को पूछा कि व्हाट इज योर नेम, सो ही विल इमीडिएटली रिएक्ट टू योर क्वेश्चन, बट अगर किसी ने ड्रिंक किया है और उसको आप बोलेंगे व्हाट इज योर नेम, सो द रिएक्शन टाइम ऑफ नॉर्मल पर्सन एंड ड्रंकन पर्सन इज डिफरेंट, सो ड्रंक पर्सन विल react usually late. Okay, so reaction time will be increased, and finally again if there is a increased concentration of alcohol in the body, you will go in a coma and finally death. So raised concentration of ethanol will cause this. Okay, so now अगर लिमिट में पिया है आपने तो क्या है, so ethanol will be converted into acetaldehyde by alcohol dehydrogenase, right? Increased level of acetaldehyde in your body will cause nausea, vomiting, headache, hypotension, inactivation of your folate, जो फोलिक एसिड होता है उसका inactivation हो जाएगा, और decreased bioavailability of vitamin B1, that is thiamine. Okay, so acetaldehyde is not a good for your body, that's why it is metabolized into acetic acid by aldehyde dehydrogenase, right? So aldehyde dehydrogenase will metabolize acetaldehyde into acetic acid, and this acetic acid will be converted into later on this carbonic acid and carbon dioxide. Now this aldehyde dehydrogenase enzyme is inhibited by this disulfiram drug. अगर इसको इनिबिट करेंगे तो ये इसका कन्वर्जन नहीं हो जाएगा, so that means if there is aldehyde dehydrogenase enzyme is inhibited by disulfiram, that means acetaldehyde will not be converted into acetic acid and there will be accumulation of acetaldehyde in the body, ये इसका लेवल बढ़ जाएगा बॉडी में, तो ये सब सिम्टम्स मिल जाएंगे आपको। तो अगर ज़्यादा इसका लेवल बढ़ जाएगा तो ज़्यादा सिम्टम होंगे, वोमिटिंग, नोशिया, वोमिटिंग, डायरिया हो जाएगा, हेडेक हो जाएगा, थ्रोबिंग हेडेक, हाइपोटेंशन, palpitation, okay, so he will feel, the patient will feel restlessness. That's why here these are known as disulfiram like reactions. Another drugs those will show these kind of reactions, they are known as a drug will show disulfiram like reactions. Okay, then again this disulfiram treatment is carried out in the hospital only, क्योंकि ये सब complications होते हैं, इसलिए ये disulfiram जिसको भी देना है हॉस्पिटलाइज करके ही देते हैं। So ये हो गया disulfiram. Now this alcohol dehydrogenase enzyme itself is inhibited by this fomepizole, which is a long-acting irreversible inhibitor of alcohol dehydrogenase. Now is that clear about the ethanol? Now methanol. So methanol will be converted into formaldehyde by alcohol dehydrogenase, and this formaldehyde will be converted to formic acid by aldehyde dehydrogenase. Sequential metabolism is there. So alcohol is metabolized sequentially first by alcohol dehydrogenase and second by aldehyde dehydrogenase. Now methanol will be converted to formaldehyde and then formic acid. If this aldehyde dehydrogenase is inhibited, then you will get accumulated formaldehyde in your body. This will cause metabolic acidosis, ocular toxicity, and respiratory failure and death. That's why this formaldehyde is very dangerous. And that's why methanol poisoning is very dangerous. 15 ml of methanol will lead to फेटल सिम्टम्स, मतलब आप 15 ml मिथेनॉल लेते हो, 15 ml, जस्ट 15 ml मिथेनॉल लिया आपने तो आप मर जाओगे। तो ऐसा नहीं कि नहीं नहीं मेरा स्टेमिना बहुत है बॉस, मैं 3-4 क्वार्टर पचा लेता हूँ, ऐसा नहीं होता। अगर गलती से भी आपने 15 ml भी मिथेनॉल इंजेस्ट किया तो आप मर जाओगे। सो समटाइम्स व्हाट हैपेंस, आपको न्यूज़ में देखते होंगे आप, यहाँ पे देसी शराब पीने की वजह से 20 लोगों की मौत, यहाँ पे इस सिटी में देसी शराब पीने से 10 लोगों की मौत। ऐसा क्यों होता है? क्यों? बिकॉज वो देसी शराब जो होता है, जो जो बनाते हैं, चुप चुप के बनाते हैं लोकली, जो आपका गुड़ होता है, गुड़ को फर्मेंटेशन करते हैं और उसका शराब बनाते हैं। तो उस टाइम पे क्या होता है, बिकॉज ऑफ इम्प्रॉपर प्रोसीजर, इम्प्रॉपर फर्मेंटेशन, सो इंस्टेड ऑफ जनरेटिंग इथेनॉल देयर इज जनरेशन ऑफ मिथेनॉल। और उनको तो मालूम नहीं ना, उनके पास थोड़ी लैब है कि वो थोड़ी चेक करेंगे क्या है इसमें मिथेनॉल है या फिर इथेनॉल, नहीं चेक कर सकते। सो समटाइम्स व्हाट हैपेंस इन द देसी और देसी दारू और रात भट्टी, सो दे इट इज यूज्ड टू जनरेट मिथेनॉल इंस्टेड ऑफ इथेनॉल, और वो मिथेनॉल की वजह से पॉइजनिंग होता है और मर जाते लोग। आपको न्यूज में आता है मॉर्निंग में, यहाँ पे देसी शराब पीने की वजह से 10 लोगों की मौत। तो वो वैसे नहीं होती है, वो वहाँ पे मिथेनॉल हो गया, मिथेनॉल आया उसमें। नाउ अगेन देयर इज अनदर अल्कोहल नोन एज इथिलीन ग्लाइकोल, so it is also metabolized by alcohol dehydrogenase to the glucoaldehyde, and which is then again converted into glycolic acid by aldehyde dehydrogenase. This glycolic acid is converted to oxalic acid. Now accumulation of glucoaldehyde will also cause CNS depression, metabolic acidosis and nephrotoxicity. So these aldehyde products are damaging to the body. So this was about the metabolism. If you be, it will be clear about metabolism. सब clear हो गया metabolism? Should I move forward? So this was all about the alcohol. So we have seen the alcohol. Alcohol में इतना important है, ज़्यादा कुछ अगर पढ़ना है, आपको इंटरेस्ट है, आप पीने में इंटरेस्ट है, तो आप केडी त्रिपाठी में से पढ़ सकते हो, उसमें भी बहुत कुछ इन्फॉर्मेशन दिया है। या फिर आप कौन सा भी बुक ले लो, सातस्कर भंडार ले लो, उसमें भी दिया है। सो इट वॉज अबाउट द अल्कोहल। तो इसका एक्शंस क्या है? नाउ व्हाट इज द यूज ऑफ अल्कोहल? यूज तो मेंशन नहीं किया है यहाँ पे, लेकिन मैं बोलता हूँ व्हाट इज यूज ऑफ अल्कोहल। So alcohol is not clinically used. Okay, it is used externally as an antiseptic, disinfectant. So it is used in the 60. It is used in the 70 to 90% concentration for the antiseptic and disinfection purpose. Then again, it is also used as a solvent. Ethanol is used as a solvent in various industry or various steps. Okay, so it is used as a solvent. Then again, this ethanol. Okay, this alcohol, ethanol is used as a for the synthesis of drugs, okay, for the reactions. Then so these are the use. Clinically it is not used therapeutically, it has some analgesic activity. It will decrease your pain, but it is not used because various analgesics are available. So the risk and risk ratio is very high with alcohol. That's why alcohol is not used as an analgesic. So you have different options. You have paracetamol, ibuprofen and all that. Okay, non-steroidal anti-inflammatory drugs. So these are there. So clinically it is not used. Alcohol is not used. You should know. इसके ऊपर क्वेश्चन आता है, फॉर्मिपियाजोल इज अ ड्रग ऑफ चॉइस इन अल्कोहल पॉइजनिंग, सो डायसल्फाम कैसे एक्ट होगा। ओके, इसके ऊपर एक क्वेश्चन आता है। मिथेनॉल पॉइजनिंग, इथिलीन ग्लाइकोल पॉइजनिंग में फॉर्मिपियाजोल इज अ ड्रग ऑफ चॉइस। डायसल्फाम किस में यूज करते हैं? इथेनॉल में। फॉर्मिपियाजोल क्या है? अल्कोहल डीहाइड्रोजनेज इनहिबिटर है। आपका डायसल्फाम क्या है? अल्डिहाइड डीहाइड्रोजनेज इनहिबिटर, राइट।